Okay, this is part 2 of videos which are related to human aging. Human's aging, it is about extracellular matrix stiffening. Okay, so we just repeat some already things which I already mentioned in previous videos, but okay, let's do it again. In response to tissue damage and local increase in extracellular matrix stiffness, healthy cells convert into hyperactive senescent cells, also known as zombie cells, allowing for faster wound healing. However, aging mammals experience chronic extracellular matrix stiffening in all tissues due to mechanisms such as elastin fiber destruction, elastin replacement by collagen fibers, and collagen fiber cross-linking by sugar molecules, so in so-called glycation reactions. Furthermore, as the extracellular matrix stiffens, phagocytic migration becomes more difficult, resulting in further increase in the number of senescent cells in aging mammals. Here we see a schematic presentation of the extracellular matrix with elastin fibers, with collagen fibers, and with hyaluronic acid and some jelly-like substance which fills the space, and in this space the immune cells and stem cells can migrate, also like fibroblasts, and this is how our most of the body exists. So about only 20% of the total volume of our body belongs to cells. The rest is the extracellular matrix with all these structures and hyaluronic acid. Despite the fact that glycation reactions are slow, the danger of this process in that extracellular matrix stiffness exceeds a certain level. Healthy cells spontaneously convert into zombie cells, resulting in chronic tissue inflammation and eventually premature death. Senescent cells produce a senescent associated secretive phenotype, SASP, that causes chronic inflammation of body tissues, eventually leading to tissue degeneration, fibrosis, and death. External manifestations of extracellular matrix stiffening include skin elasticity loss, wrinkles, and sagging skin, as well as blood hypertension, vital lung capacity reduction, nocturia, and muscle elasticity loss. According to experts, an increase in the extracellular matrix stiffness with age cannot be avoided or reversed, limiting human life expectancy to 100-120 years. There are exceptions, however, such as naked mole rats, which have distinct skin characteristics due to a high concentration of hyaluronic acid in the extracellular matrix. And hyaluronic acid is important in tissue regeneration, inflammation response, and angiogenesis, all of which contribute to wound healing. Naked mole rats have skin that is highly elastic and rubbery, allowing them to move and scream in tight tunnels without injury. In comparison to other mammals, their skin elasticity remains largely unchanged with age. Pardon. The standard American diet, which is high in carbohydrates and vegetable oils as primary source of energy, causes premature aging and extracellular matrix stiffening. Carbohydrate consumption raises blood glucose and insulin levels, causing glycation reactions to speed up and collagen fibers to cross-link. A ketogenic diet can help to slow the rate of glycation. High insulin levels in the blood eventually lead to insulin resistance and type 2 diabetes. High insulin levels in the blood can also cause neurodegenerative disorders, which are commonly referred as type 3 diabetes mellitus. Insulin molecules can climb together to form amyloid plaques that bind to insulin receptors in brain cells, disrupting glucose metabolism. As a result, even with high level of glucose in the blood, brain cells become less sensitive to insulin. They starve and die. Alzheimer's disease, a neurodegenerative disorder that affects millions of people worldwide, is characterized by the accumulation of amyloid plaques and tau protein in the brain. Thus, a diet in which glucose is the primary source of energy for brain can lead to Alzheimer's disease, whereas switching to a ketogenic diet in which animal fats are primary source of energy can improve cognitive performance even in Alzheimer's patients. here we see at this slide schematical presentation of the brain with clusters of these amyloids, misfolded protein, and aggregates of the insulin molecules, and this the hallmark of brain aging, and this also leads to inflammation. So the consumption of carbohydrates eventually leads to neurodegenerative diseases. Vegetable oils derived from plant seeds should also be avoided in older age because they contain polyunsaturated fatty acids, which react with reactive source oxygen species produced by aging mitochondria, become toxic, and accumulate in cell lysosomes as lipofuscin. Lipofuscin accumulation in the lysosomes of long-living cells can lead to cell apoptosis over time, and macrophages try to rid the body of oxidized polyunsaturated fatty acids but are unable to digest them. It causes them to accumulate in lysosomes, this lipofuscin, and convert macrophages into foam cells, so-called foam cells, which eventually die out. Atherosclerosis is caused by accumulation of dead macrophages in artery walls. Make more rats. Okay, then, sorry, I was talking about this, and just this slide shows how this plug, this lipofuscin accumulates in the wall of large arteria, and so it is actually atherosclerosis. Okay, and this is again schematical presentation how atherosclerosis develops. So we have this myocytes migrate, and they try to get rid of this oxidized polyunsaturated fatty acids, which are in low density lipoproteins, and then eventually they get converted to foam cells, and foam cells die out, and we have accumulation of the lipofuscin, and actually it is fat in the artery wall. Okay, this video was done for educational purposes. It may contain copyrighted materials, in pictures, but as I am not using it to generate money or medical advice, not provide medical advice, I am not violating the copyright regulations. So, and I provide links to images in the PDF file of the presentation, and the link to the presentation is in the video description. And again, I express this is only my personal opinion, and I'm not medical expert. A visitor of my channel is advised to discuss the content of this video with his or her personal physician and only act upon the advice of professional medical experts. I don't do it personally because I am doctor of science, and I never get sick. Even flu, it is already many years, almost 30 years, I didn't have it. Absolutely not. Why? Because, okay, I try to think and I try to keep the healthy lifestyle. Okay, thank you for your time to watch the video. Please comment, subscribe, like, ask questions, and share information. Have a wonderful day. Ciao, ciao.